I want to shift focus on the vaccine rollout in the country. Remember, it was on first and second. Very important meetings took place, and then, of course, there was this controversy. But what we are learning right now from our sources within the Ministry of Health, it could be as early as in the next 10 days that the vaccination process in the country could officially start. The Union Health Ministry has announced the vaccine rollout will start from 13th January, 10 days after India's two vaccines, Covishield and Covaxin, were granted emergency use approval. Health Ministry further added, states are ready for the rollout and the dry run was successful. The vaccination registry will be done through the CoWIN app. The Health Ministry has said the application will be available in 12 languages and will be a 24-hour helpline. Health Secretary Rajesh Bhushan also said the app will be global and other countries can use the app as well.
हम इस स्थिति में हैं कि जिस भी दिन हम चाहेंगे EUA के 10 दिन के भीतर हम उसको EUA का अर्थ है इमरजेंसी यूज ऑथराइजेशन, ये बोलचाल की भाषा में शब्द प्रयुक्त होता है। हमारे मीडिया के मित्र इसी शब्द का उपयोग करते हैं। हमारे कानून में एक्सेलरेटेड अप्रूवल फ्रेज का इस्तेमाल किया गया है। तो जिस भी दिन हुआ, जैसे अब आप जानते हैं कि किस दिन हुआ, उस दिन से 10 दिन के भीतर में ये रोल आउट होने की पूरी तैयारी है। बेनिफिशियरी रजिस्ट्रेशन की आवश्यकता हेल्थ वर्कर्स और अदर फ्रंटलाइन वर्कर्स के लिए नहीं होगी, क्योंकि इनका डाटाबेस जो है वो बल्क डाटाबेस है एंड हैज बीन पॉपुलेटेड ऑन टू द कोविन वैक्सीन डिलीवरी मैनेजमेंट सिस्टम इन अ बल्क मैनर. So our doctors, our nurses, our medical workers need not self-register themselves on the CoWIN platform. Their data has already been pre-populated. Similarly, our frontline workers, which means people in the armed forces, in state police, in central police, in municipal workers, they also need not self-register themselves because their bulk data is also getting pre-populated.
They are very angry. Bharat, Biotech took, pot shots at Serum Institute vaccine Covishield. Both, the giant, the pharma, big companies, both of them have been given the emergency use approval in the country, were in fact at each other's throat, which was affecting the confidence of the people across the country. Now, there has been some sort of a truce which has taken place between Bharat Biotech and Serum Institute. In a joint statement, Serum Institute and Bharat Biotech said they are committed towards providing global access for coronavirus vaccines. The vaccine makers further added, saving lives and livelihood, also ensuring economic normalcy returns, is the most important factor for them. Serum and Bharat Biotech also stated they consider developing the vaccines as a duty to the nation. The statement comes a day after Bharat Biotech chairman Dr. Krishna Ella refuted allegations the vaccine developed by his firm was not effective and the vaccine was like water. Meanwhile, let me now, in fact, get you this exclusive interview. Our business editor, Rajiv Dubey, spoke to chairman of Bharat Biotech, Dr. Krishna Ella. Listen in to this conversation.
See, the pandemic was too fast, two things happening fast. Too fast is happening. So we as a manufacturers, particularly, we're doing R&D, manufacturing and publishing. The people are not patient enough. They want publication takes at least 3 to 4 months. I mean, you can ask Velumani or Srikanth Reddy. You can watch 4 to 5 months, 6 months sometimes, publication by all peer-reviewed, answering all the questions. It takes 5-6 months. They want like instant. I put a paper, it should come in 1 week publication. In spite of that, we are accepted journals and putting in the public domain. Many people doesn't read that also, and they come in the media saying that company is not transparent, company is not put in the media, company is not a peer-reviewed journal. We are publishing an entire peer-reviewed journal. I am a scientist myself. I don't want to be published in a non-peer-reviewed journal for the sake of publication. I will never do that. So my standing also is important in the country. So I think, we produce one of the best journal, but one of the conditions of the journal is I'm not supposed to tell the journal name until it comes into public domain. That's a rule. Srikanth Reddy will agree that if some ex-journal accepted my publication, they say you can put in the public domain, but you cannot say which journal it is until it's published. So some of the journals are coming in January 10, 15. Every journal's articles coming one after another one. So we are the only company have a 5 research article equal to Pfizer. Pfizer has got 5 publications. We also have 5 publications. Okay, right. So we are open to have a global competition in peer-reviewed journal. And the only thing is, people doesn't trust Indian companies. They think Indian companies are not research-oriented. We are commercial-oriented. We are not. The new generation people like us, we are sincerely interested to have good science and science to give back to the society. That's how we believe in it.
But is there a future in open source drug development, open source vaccine development? Do you think that is a possibility or it's not?
No, it is not possible. The reason
interoperability of data, interoperability of information.
Very difficult. Very difficult. The reason is the market competition is so intense in a vaccine field. Okay, nobody would like to have open source. Very difficult. And what might happen is sharing of manufacturing capabilities. That might happen. Not the open source, open intellectual properties, all will not happen because every commercial company is a commercial in the end. And they would not like it. If it's open source, if I develop a product, I launch it, somebody else takes open source, it takes 1 year for me to develop, for that fellow will take in 1 month to come into the market.
Right.
So it's not an incentive for any manufacturing company to come in open source. What I would say is, having 25 years experience in the vaccine field, there are 2 ways to look at it. There are some viruses which the immune response is not right one to compare. For example, rotavirus vaccine. You look at the immune response to rotavirus is very bad. It doesn't produce much immune response at all in our body. So we depend on an efficacy trial, whether it works in a field situation, in a diarrhea. That's one option. There are other viruses like Japanese encephalitis, hepatitis B, and rabies. All these are viruses where we look at immunogenicity as an end marker. It's not that I'm denying the phase 3 efficacy is not required. Please underline that it is required. I'm not saying that. But you have to come out some conclusion, somewhere quick response. If you want, do you look at the immune responses to RBD, antibodies to RBD, antibodies to S protein? You look at it as an end marker. So look at it, can we make some judgment out of it? Yes, we can make some viruses, we can make a judgment. Efficacy, I'm not denying that. We are going through efficacy and we'll be completing that. I think today will be the last day. We'll be completing 26,000 people. Probably today will be the last day for us, completing our entire enrollment of 26,000. There are some people questioning us, how come, you were 13,000 when 2 weeks back, now you're 26,000. Media raises some suspicion on this sort of thing. I think, we are given the clinical trial to IQVIA, which is a American multinational company. The reason we gave, because people doesn't trust Indian companies. So we have to give it to the American company to vet our data. That's the sad part of this country. Okay, so we give it to them, and I think we will be producing any data which is our global standard. Nothing like Indian company will be a global type of data will be there.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.